Hi everybody, welcome to another Chats with Chaudhry. I hope you're safe and well. It's a lovely sunny day here in Surrey and I'm delighted to be joined by someone I so really get to speak to, let alone see, in Karen Rossington from Contec. And she's laughing, she knows this is only the third time I'm actually physically speaking to her, let alone seeing her in 4 or maybe 5 years. God, so I think this is a rare opportunity. So Karen, it is lovely to see you. And today we are going to be talking about a current hot topic, which is cleanroom contamination control. So Karen, lovely to see you. Where are you calling in from today?
So I am based in South Oxfordshire, and yeah, we have a sunny day as well. So I'm very much looking forward to telling you about some of the cleaning and disinfection topics that we're currently working on.
Fantastic. Well, look, I'm glad the sun's shining. It was really bizarre weather, isn't it? I mean, it was snowing here 2 days ago, which is
It's
really
mad. It's mad. The joys of living on a little island.
I know. All right. So before we start talking about cleanroom contamination control, for those people not familiar with Contec and you, could you give us a quick background on yourself and also about Contec?
Oh, yeah, of course. So I'm Karen Rossington, and I represent Contec for their technical marketing in Europe. I've been working with Contec for 10 years now, but I've been in this industry and working in contamination control for over 25 years. So Contec is a leading manufacturer of contamination control products. So critical cleaning, disinfection in clean rooms, critical environments, and that's worldwide. So Contec's wipes and mops, they're used in various industries across the globe. Anyone that has got a critical application, really. So biotech, pharmaceutical, medical device, healthcare, any critical life science application. So they're based in the United States, but we have manufacturing plants in Europe and Asia. And we've been developing and manufacturing contamination control products now for over 30 years. So Contec really do understand the unique challenges that are faced by these highly regulated markets with regard to contamination control. So they've got a really wide range of disinfectants, mops, wipes, accessories that have all been specifically developed for the needs of life science clean rooms.
Right. Okay, cool. So you have an event coming up, which prompted this conversation in the first place. Your very first ContecTalks European Seminar, which is running on April the 29th. So what made you decide to host a seminar in the first place?
Well, there was a couple of reasons, really. So we've been hosting individual webinars now for a couple of years, and we do lots of presentations with other organizations as well. But last year we said, look, come on, we've got enough things we can talk about, enough work that we've been doing, that we should put together a full seminar program, something that was just solely related to contamination control in life sciences. So we'd planned to do a face-to-face event in the United States last November, and then we would have followed that up with the face-to-face conference in Europe. But current situation, we had to turn the US meeting into a virtual seminar. So we had to make it shorter, but it was really well received. So we said, okay, let's do another one virtually. We can't all get together in person yet, hopefully later on this year. But we'll do another virtual one in Europe, and we'll make the sessions more European focused.
Cool. So let's talk about the topics you're covering. So I know you're doing an update on the draft Annex 1 of Good Manufacturing Practice for medicinal products. So why is Annex 1 so important?
Well, as most of the listeners will know, the manufacture of medicinal products in Europe is governed by the requirements of EU GMP. Any manufacturer of a medicinal product has to meet the requirements of good manufacturing practice for medicinal products.
Sure.
And Annex 1 of that covers sterile medicinal products. So that's anything from chemotherapy drugs, total parenteral nutrition, insulin, and obviously something that's very topical at the moment, vaccines. It was first published all the way back in 1971. And what people don't necessarily realise is how few updates it's had. So it had partial updates in 2003 and 2007, but it's had no full revision since 1996. So basically, it's out of date. So over the past 2 years, maybe even slightly longer, it's been worked on. It's been completely rewritten to take into account changes in technology. You know, if you think of all the things that have changed, even from 2007, there's been updates in regulatory expectation. It's got to keep up with other documents that have been published. So that's things like ICH 9 and ICH 10. It's been out for consultation numerous times. We're actually at version 12 of the Annex. It's still with the International Working Group, but it's now looking possible that it's going to be finalised in July, and then potentially released in September this year.
Yeah, right, okay.
And it will have some significant changes in relation to contamination control.
So what are some of the key points you'll be covering around the new Annex 1 in your talk at the seminar?
Well, the whole Annex has been expanded. So it's gone from, currently it's 16 pages. The draft at the moment is 52, I think, something like that. So everything has been expanded, including the topic of cleaning and disinfection. So there's going to be this new documentary requirement for an holistic contamination control strategy.
Right.
And something else that we've picked up within the draft is that there's numerous mentions that cleaning and disinfection are two separate processes. You're trying to achieve two different things. So it says in there that cleaning should be performed prior to disinfection, for instance, and that you're going to have to validate that it is able to remove the residue left from disinfectants.
Right. So I also know that explains why you're also discussing the managing disinfectant residue in pharmaceutical clean rooms. So why are disinfectant residues such a problem then?
So Neil Simpson, he is Contec's R&D and European Technical Manager. He's going to discuss this in more detail. So all detergents and many disinfectants leave a residue on a surface. So not only can this damage your surfaces or your equipment, but as that residue builds up, it can also interfere with the disinfection process going forward. There are no currently approved or validated methods for assessing the amount of residue left on a non-product contact surface. So there's a lot of work that's done about validating cleaning vessels, for instance, but nothing just for your standard clean room surfaces. So what Neil's going to look at is how you qualify the amount of residue that a disinfectant leaves, the effect that a different surface might have on how a residue looks, and then quite a lot of time on how to best approach residue management in a clean room.
Right, okay. There's quite a lot there to be covered then.
Yeah.
You're also being joined though by Tim Eaton from AstraZeneca. So what's he going to be talking about?
Yeah, so Tim is a sterile manufacturing specialist. So he's been working in sterile manufacturing for again over 25 years in AstraZeneca, and he's kindly agreed to join us to talk about airborne contamination control in clean rooms.
Right. So, and what are the main challenges controlling airborne contamination?
Right, not my area of
Right.
speciality at all, but the deposition of airborne particles is one of the predominant routes of contamination in your clean room, even, microbial contamination.
Right.
So what Tim talks about is what the sources of that airborne contamination are, and the fact it can both be non-viable, but you also get MCPs, so that's microbe carrying particles.
I'm glad you told me that. I was going to ask you what that meant.
Yes, MCPs, microbe carrying particles. So he talks about what the sources are, but he looks how he's been researching this over a number of years. He looks in particular at the personnel in the rooms and how they disperse such contamination. So regardless of what airflows you've got in there, the way that they move about and the clothes that they wear, how that can move the contamination around. So I'll be listening to that with interest as well.
Well, actually, obviously, quite a lot of interesting topics there being covered. But you've also got, I understand, a special guest star who is out of this world. I had to throw that in.
We do. We have astronaut Captain Scott Kelly, so a NASA astronaut. So, I said that we had done this virtual seminar before. We ran this in November in the US. So we partnered with Captain Scott Kelly then, and he gave the keynote speech on the importance of maintaining cleanliness and hygiene in the most critical.
Yeah, I can imagine.
Can you imagine the most critical environment you can imagine, the International Space Station? So it's videoed. It won't be with us live, but we will have the video from last year where he talks about the challenges that he and his crew have faced on all of his missions. But he specifically talks about his time on the International Space Station. So as well as talking about just the dangers of being in space, something that's really relevant that we can all now sort of empathize with is he answers questions about how he coped with isolation. So he spent 340 days on the International Space Station. He is absolutely fascinating. So yeah, we get about an hour of him doing his talk, and then also we'll run some of the questions that he answered for us last year. It's really good.
Oh, well, actually, I'll have to make sure I register and listen to that, because I don't think I've hardly been out of my room, let alone my house, for 364 days.
Oh, yeah. I mean, can you imagine 340 days on the space station? I think there's only about 5 people, I think, that have spent that sort of length of time in space. And if you don't know him, I mean, Google him. He's a twin, and his twin's an astronaut as well. So what it gave them was an opportunity to compare exactly him having a year in space and his twin who stayed on Earth, to see the effect that it had on a human body.
God, that's really fascinating, actually. Yeah. That is really interesting. So if people want to know more and register for this event, how can they do so?
Okay, so we do have a web page specifically for it where you can register. But the easiest way is probably if you go to our website. So that's contecinc.com/EU. And at the top of the page, there's a link to the web page specifically for the event.
Great.
So that then has got all the information on there about the seminar. So the full agenda and a description of each of those presentations is on there. All the speaker biographies are on there. So it's free to register. You can register on that web page. We do have a link to that, which I think will you put somewhere?
I will put, in fact, I'll put everything above the video. So although you've explained it very well, Karen, I will put all the links above the video as well, so people don't have to remember what you just said to them. They will literally be able to just click on the link above the video.
Excellent. Okay. That's really good.
So, and sorry if anyone heard a phone ring in the background, that's my son from his football trying to ring us and say, come and pick me up. So I'm ignoring him, letting my wife pick the phone up. So there you go. So the beauties of doing video live. Well, that's great. That's really interesting, Karen. I mean, I actually I'm looking forward to attending myself and finding out a bit more about it. I'm really looking forward to the interview, obviously, from Mr. Spaceman there. That'd be really interesting. That'd be really good. So all that, we run out of time. So all that say, thank you very much for taking the time out to explain to me a bit more about what you're doing at the seminar, and also highlighting the topics themselves. I think it's really interesting, because it's funny. I was thinking about this last night as I lay awake ready to start my fast for day 3, that contamination and clean rooms aren't the most sexist of subjects, but actually they're so important if you look at it in terms of pharma and life science, in terms of making sure you get it right. Everyone talks about ATMPs and biologics and everything, biosimilars, but actually if you don't have things sterile and contamination free, you can't do the other stuff that you need to do. So it is a really, really important topic. So thank you for taking time out to talk to me about that. So well, I look forward to hopefully catching up for a 4th time maybe within the next, or hopefully I'll have to wait another 2 years to catch up with
I'm
you.
going to say, wait, we're not due to speak face to face for at least another 2 years.
Yeah, I know. Well, that's the way it goes, actually, I think. But hopefully we can speed it up a bit more now that you've done this. But I wish you a lot of success with the event. Obviously, fantastic. Have a fantastic 2021 as well. And hopefully we can catch up again soon. As Karen has said, if you'd like to know more information and register for the event, and it's free, isn't it? I am right in saying.
Yeah,
It's a free event. And if you want to find out more about all the topics that Karen's just discussed, you can register for the webinar, the seminar, not the webinar, the seminar. The link will be above the video, and so you can do that then. So all that's done is, Karen, thank you very much. Look after yourself.
And you, lovely to talk to you.
And thank you all for watching. Until next time, as always, stay well and stay safe. Bye-bye.
Bye-bye.